Hi, Olivia.
Hello.
Yeah.
How are you?
Yeah, I'm good, thank you. I'm good. You?
I'm very, very good, thanks. Looks like everything's working. That's always a good start.
Fantastic, we're in.
We're in. So thanks for being here. Just give everyone a minute or so to join.
All right, yeah.
And maybe I'll just start explaining a little bit about this live and some more like these that we are hoping to do in the coming weeks as the public health collaboration, which I'll talk a little bit more about in a moment. We are having our annual conference in May this year, and we are really excited about it, and almost can't contain ourselves, but we are hoping others will be as excited as we are in the coming weeks. And to help with that, we are looking to talk to some of our speakers, introduce them to the guys that will be coming, and anyone in the audience that's going to be coming along or live streaming, so that everyone can be familiar with who's coming along and be getting as excited as we are. So thanks everyone for joining this evening. We are very lucky to be joined by Dr Erin Bellamy, who will be one of the speakers at our conference, moderating a panel. And we'll ask Erin to introduce herself in just a moment. But to start off with, just to introduce myself, I'm Olivia Quadja. I am a trustee of the Public Health Collaboration, and we are going to have a format tonight which is going to include a little bit of intro into our charity and introduction to Erin. She's got a very interesting story to tell us, and then looking ahead to the conference, find out exactly what Erin is going to be hoping gets discussed in the section that she's part of, but also what she's looking forward to hearing about from others who are coming along based on our very exciting schedule that we've put together. So hope that sounds all right. If anyone has any questions as we go for Erin or for us as Public Health Collaboration, then there is a little speech bubble that you'll see at the bottom of your screen with a question mark in it. If you can pop them in there, it's a lot easier to pull them out from any chat that is also occurring. So hopefully people are able to do that. So please do ask questions as we go as well. We'll try and use those. But just to start off with, if anyone is not familiar with the Public Health Collaboration, we are a charity that exists to inspire and to empower people to understand their metabolic health, and that's both the public and healthcare practitioners equally. And our vision is to move to a society where everyone has good metabolic health and everyone is able to live a life that is free of chronic illnesses. And so as a charity, what we do is try and help educate those two different parts of society, but we don't just stop at that. We are very active in actually making the change that we want to see happen and doing that within the system itself. So, for example, we have programs that are working with the NHS to take on patients that are pre-diabetic or diabetic and to actually help them reverse that or to get to a much better position with their disease process. And that's something that is offered to the NHS and a program we want to see rolled out much more widely, so that low carb is the preferred approach that the NHS use for treating type 2 diabetes. That's one program that we have. We also have one which is helping people deal with food addiction, and something Erin will be able to maybe comment on a bit more. But that's a pilot program that we're running to try and look at how certain people who are struggling with dealing with kind of changing their diet need extra help, and that is a program that we are starting to offer as well. And we are also looking to, at the other end of the spectrum, the non-sick people, to actually help the younger generation and children in particular get some aspect of their education that includes understanding the dangers of ultra-processed foods. So these are the kind of programs that we do as a charity, which are actually trying to make the change happen that we all want to see. So we believe it's a fantastically important charity to support, and anyone who can support us, we are very grateful for that. And the absolute best way to support us is to come along to our conference. It is our annual event, and all the proceeds from that go directly to the programs that I just talked about. And unlike most, well, pretty much every other health conference that you may consider going to, this conference allows the change to actually happen as a result, and is not for profit. It is purely for our charity to do the good work that it's here to do. So we're really appreciative of anyone who would like to support us in that cause, and hopefully more and more people will support us at a grassroots level, because we don't take any funding from any industries, and so we do rely on grassroots support. So thank you for being here, thank you for supporting our conference, and we'll talk a little bit more about what you can do to come along. But for the most part, I think we'll just start and ask Erin Dr. Erin Bellamy to please introduce herself, tell us a little bit about your background and your story and how you came into the world of metabolic psychiatry.
Yeah, thank you so much for asking. Hi, everyone. I'm sure I feel like a bit of a broken record at this point, because I've been wandering around telling everybody my story the past couple of months. But yeah, so I'm Dr. Erin Bellamy. I am a metabolic psychiatry clinician and researcher. I've just finished my PhD in psychology, where I specialized in the ketogenic diet for depression. And so I've been working on that for the past 7-8 years. And then alongside that, I've been working with people to implement a ketogenic diet, a low carbohydrate diet as well, even a carnivore approach for those with both mental and physical health conditions. So everything from type 1 diabetes, type 2 diabetes, to food addiction, to mental health concerns such as schizophrenia, depression, anxiety, binge eating disorder, and bulimia, and so on. So I've been quite busy the past couple of years, and it's kind of all coming together now with the end of the PhD, and I'm looking now to kind of publish the findings and so on, and also just trying to get out there and kind of share the message, really. The field of metabolic psychiatry, as you know, and as everybody who's watching knows, has just kind of blown up in the past year, maybe less than a year. And so it's just so exciting to see the research coming out, see the clinicians coming out of the woodwork and saying, yes, I've been doing this, and yes, it seems to be helping, and just kind of coming together as a community to share that and to push the research area forward.
That's great. And just what you said there about how it's really expanding and becoming more known in the last year that the effect of diet can have on mental illnesses. You could probably contrast that to the beginning of your journey and tell us a little bit about how that came about, because that was quite a while before any of us had ever considered this theory, and how did you proceed with trying to grow that movement from the start?
Yeah, exactly. I mean, it was a long time ago, back in 2014, 2015, so about a decade ago, where I was working in the National Health Service with people who were really unwell on the inpatient psychiatric wards. And, I wanted to help people. I wanted to be a psychologist. I wanted to do my best to help people feel as best they could. But my other passion had always been eating disorders, and so that's where my research focus was. So I was always interested in diets and the latest diet. What can this do? What can that do? And if you think back, if people who are online listening now think back to 2014, 2015, that was kind of the beginning of the movement of a low carbohydrate diet might have beneficial effects for type 2 diabetes and pre-diabetes. And so I was looking at all the people that I was working with, all of my patients, and a lot of them had what we now know to be metabolic syndrome. They had type 2 diabetes, pre-diabetes, and so on. And I thought, gosh, I came across this low carbohydrate diet and thought, well, if it's working for type 2 diabetes in the general population, then, maybe it would work for the patients that are on my ward. Perhaps, it would be helpful to them. And so I then decided that in order to test that, I couldn't do that with my patients in a clinical setting, because it's not standard, it's not first line treatment. And so I thought, okay, let's have a look at the research and see if there's anything on the mental health side. Lots to do with the physical health side, anything to do with maybe low carb, ketogenic diets and mental health. And I keep coming back. I swear the authors of this paper, they're probably going to have to give me royalties or something. I keep coming back to this same paper, this paper from 1965, where they took 11 females who had schizophrenia, like delusions, hallucinations, put them on a ketogenic diet, and all of their symptoms improved. So hallucinations, delusions, all of them improved. And when they put them back on their standard diet, all of their symptoms, hallucinations, delusions came back. And so to me, that's groundbreaking, right? I was like, what do you mean? Like you change the diet and these symptoms improve, and then you give the diet back and then they come back again. Like, what?
It's almost like it has something to do with the diet.
Yeah, imagine. And I thought, okay, great. Like I found the jackpot. Like I found the research I've been looking for. So I was like, okay, like let me see what other research there is. I went digging, and then I just thought I was a bad researcher because I couldn't find any more research to back it up. And it was like 50 years ago. And I just thought, this is bananas. Like I don't understand this, but there's something there. And I was looking at that low carb type 2 diabetes research and thinking there's something here. So I thought, okay, I'm gonna have to go. Not gonna have to. I would like to go and research this a little bit more and see if the ketogenic or a low carb diet can improve aspects of psychological well-being, anxiety, depression, and so on. And so that's what I did. So then I just embarked in 2016 on my PhD journey, self-funded it, did it part-time because nobody was interested. I think now I know, like Dr. Ian Campbell was up in Scotland and he was kind of doing it, and there was a few people dotted around who were researching, but you know, this is before Zoom, this is before GoToMeeting, this is like barely, like kind of around the time of Skype was just about cool. So nobody was communicating in the ways we communicate now to even share this kind of story or this research. And so I was very much in my own little research silo, telling everybody who came in contact with me that a ketogenic diet might help their mental health. So I banged that drum on my own for a really, really long time. And I had to be careful because, you know, you get a lot of kickback of, oh, this is a diet versus a therapeutic intervention, of which it is both, you know, that you can use them in two separate ways. And so, yeah, so now we've come to the end now, and things are starting to pick up. You know, there's a lot of focus on this area of what is now coined metabolic psychiatry. And it's just nice to have come out the other end and meet other people that are focused on this area, and for the spotlight to be on it now, whereas it hasn't been for past 10 years.
Yes, absolutely. I mean, and even since Chris Palmer's book came out last year, everything just seems to change. And now with Georgia Ead's book as well, which we're actually reading at the moment in a book club that I'm part of, it's incredible to just, in a way, it seems kind of obvious. And why do we not think about it before, especially when we had the studies back in 1965, as you said. But like so many metabolic illnesses, you know, a way of eating which can help you has almost been used and then forgotten, and we're having to rediscover it again. So it is great to see that is now finally happening.
I think also just one thing on that is, like, if you think back to that research in 1965, after that people often say to me, well, you know, what did actually happen? Why is there a gap? And that's kind of when we had the onset of the introduction of antipsychotic medications and antidepressants and so on. So there was a really big switch over to using medications and helping people that way. And so then, you know, nutritional interventions just went out of favor. Whereas now people are kind of looking for alternatives or adjunct therapies to help them. And so these kind of therapies are coming back into focus.
So great to see. And you mentioned there that you're coming to the end of your PhD. Is there anything that you can share with us about what that might tell us in this picture as we progress through?
Yeah, definitely. Well, it's done now, so I can talk all about it. So what's interesting is one of my biggest findings was that those who follow even a low carbohydrate diet, so just removal of the ultra processed foods, kind of low carb, 90 to 130 grams of carbohydrates or so a day, even people who did that for 12 to 24 weeks saw improvements in anxiety levels, stress levels, improvement in depressive symptoms, positive and negative effect. So overall, their psychological well-being improved even at the low carbohydrate level. On the ketogenic level, when I interviewed people and spoke with people about their time on this intervention, you know, they had the usual physical health improvements that we know. So they saw things like reduction in pain medication, reduction in pain, everybody losing weight, this type of thing. But on the psychological side, what I think was the most powerful is there were people who said, in the beginning that prior to the intervention, they had little to no purpose in life. They had no get up and go. They were really stuck in a rut. Their children had left the nest and they were really struggling to find who they were and what their purpose or drive was, which for any of us would be really, really difficult to handle day to day. And then simply, by changing their diet and focusing on these things and having the metabolic effects of the ketogenic diet, in turn, at the end, they were saying things like, I found my purpose in life. I've got a renewed focus. I know what I'm doing. I've got my get up and go. I've got my drive. And so, even though overall it was a relatively small study, it still shows that there's something, because people don't just go from not having any purpose in life to having purpose in life where you're only pretty much changing one thing.
Yeah.
So it was really quite powerful, and it's really a feeder for all of the research now that's going on, looking more closely at ketogenic diet as a metabolic intervention for psychiatric conditions.
Yeah, and just imagining the scale, like if that was true and that was proven, and looking at the level of mental illnesses that we see today and how that has grown over the past few decades, it is an absolutely huge impact on society, that those people who are living possibly not even diagnosed, under the radar, and living with less than a clear purpose in life or anything along that scale. I mean, that's just so much human potential that is being wasted and has been wasted, and there's just so much opportunity here to just totally change our whole humanity.
Yeah, that's the thing. Like, I just feel I feel so strongly about it because so many people struggle with their mental health. Like, it's not that you have to have a diagnosis to be deemed as struggling with your mental health. Everybody has ups and downs, and nearly everybody goes through a period of low, and there's a lot of, I talk to a lot of people who have a lot of social anxiety, especially post-COVID, a lot of anxiety, a lot of low periods where they may class as depression but haven't quite hit the mark, and it's just like, what can you do for yourself? Like, giving the agency back to the individual, because of course, seek help. We have really long waiting lists right now in the UK, and it's difficult to be seen and to be heard. So in that time while you're waiting, like, you can do something about it. You can implement certain metabolic therapies that could help you to feel better. And so that's why I'm so passionate about it. So I'm just like, there's something that you can do and you can try. If it doesn't work, okay, fine, didn't work. Like, we do lots of things every day that don't work and we learn, but like, it does have potential. And I just think that you could just give it a go and then still have your standard of care alongside, and you could feel so much better. Yeah,
I'm just going to get a couple of questions off the chat, so thanks guys for asking. One of them was, how many cases of improvements in schizophrenia have you seen?
With me specifically, so I work privately, I think I've had about 4 at this point, specifically with schizophrenia. Schizophrenia is obviously a lot more of a rare condition than other conditions, but 4, I would say. Yeah.
And have you also had cases where it hasn't improved schizophrenia, and 4 is the successful ones, or is that all of the cases you've treated as schizophrenia?
It seems to be a little bit on a spectrum. So it's not that people don't improve, because the bottom line is you're still going to improve your metabolic health by following a ketogenic diet, especially a metabolic, like, or a therapeutic intervention based one. And so metabolically, things still improve. So weight still comes down, hunger levels still drop, binge eating symptoms still drop, all of these types of things. But in some of the people that I've worked with, maybe those improvements haven't come, like the delusions and the hallucinations, they haven't completely disappeared in some people. But in 4 people, there have been significant improvements within the time frame that is usual. So, Dr. Chris Palmer, Dr. George Eade saying currently around 12 weeks is a decent amount of time to do this in order to see if it's going to work or if it has potential. And within that time frame, that's where I'm seeing there are improvements, but some people just don't really get all of those improvements.
Yeah.
But improve significantly in other ways so that they are still feeling better than they did prior.
Yeah, excellent. And there's another question here, which is, are there any side effects when having a low carb diet for longer periods or for a lifetime style? I think
for a lifetime.
Is there any side effects from low carb diets that you're aware of?
So it definitely depends, right? So this is the barrier that we have at the moment with the research, is we're just trying to clarify what a low carb and a ketogenic diet is for each illness or for each person, because you have a ketogenic diet for treatment resistant epilepsy in children, which is very, very high fat. It stops seizures in a lot of children, like that's why it's used, but it is, or it can be, quite void of nutrients, and so therefore these young children can end up with significant nutritional deficiencies if it's not overlooked properly by a medical professional and adapted in the correct way. So there's that end, and then you've got the other end, which is following a ketogenic diet or a low carbohydrate diet to lose fat, where you can follow a very well formulated ketogenic diet with lots of variety, and the only thing you're doing is keeping your carbohydrates low, and carbohydrates are not essential for life, and so therefore as long as you get your vitamins, minerals, etc. from proteins and fats, you're good. And so you shouldn't have any you shouldn't experience any like long-term side effects at that point. And then you've got this kind of blurred area in the middle where we're using ketogenic metabolic therapy for different illnesses and different situations, and in this case mental health conditions. And so the strictness of this diet for individuals with mental health conditions also varies depending on how severe their symptoms are and the individual. So at the moment, the research shows that long term, there doesn't seem to be that many side effects long term. It seems to be relatively safe. However, I caveat that by saying that you have to, still look after your nutrition profile and so on. If you only eat yogurt and blueberries, you're going to run yourself into nutritional deficiencies, right? So you have to still try and follow a well formulated ketogenic diet where you can, to cover your bases and to avoid any onset of any long-term symptoms. Short term, most people would have heard of like maybe some electrolyte deficiency in the first couple of weeks, but as long as that is monitored, and as long as you know what you're doing, or you're working with a professional who does know what they're doing, the side effects of that can be prevented almost completely. So as you need to be informed, you need to be educated, and if you don't know, then you need to ask somebody who can support you so that you can avoid the first couple of weeks ups and downs. But generally speaking, long term, it seems to be okay, as long as you're eating a well formulated ketogenic diet where you can.
Great, thank you. And the question I just have to follow up is, to what degree does in particular in this field of metabolic psychiatry, to what degree does the mental impairment itself create a hurdle to actually taking on the diet and sticking to it? Is that something which in a way is harder than someone who's just doing it to lose weight, because they also are dealing with the mental health issue at the same time as trying to do something which might be quite a difficult transition or a difficult diet to stick to?
You would think that, and I thought that too for a really long time. When I was doing my research, one of my research questions was to look to see whether people who were quote unquote healthy, as in had less depressive symptoms, if they would be more likely to stay on the diet because it was easier for them, compared to people maybe who have more mental health symptoms and they would find it more difficult. That's what I went into my research assuming. However, the opposite was found, and the opposite is found clinically.
Wow.
Because if you think about it, like the people who, you have to think about the benefits that come out of it. So unfortunately, a lot of our treatments for mental health conditions don't get people all the way to feeling 100%, right? They might help in the interim, and they can be extremely effective in the short term, but long term, it kind of needs to be in addition to something else, because more often than not, it doesn't get people the whole way. And so what you end up with is people who just feel under the weather all of the time. And that day on day on day on day on day will wear you down. And so if somebody comes to you and says, listen, you can change your diet, there's a chance that this might help you. Yes, it's going to be difficult to change it initially, but you'll get the hang of it. As soon as they get the hang of it, as soon as they start seeing improvements, they've won themselves round, right? Because they're already seeing improvements in their mental health, and therefore then it's very easy for them to stick to, because they see how they are improving and how well they're feeling. And so it's almost like if you start taking some other type of therapy and you start feeling better, of course, a bit like exercise, you start exercising, you're like, wow, actually, I feel pretty good. Like, I'm going to continue this until such time as maybe you fall off, and then, 3 months later, you get back on it again, right? We've all been there. But yeah, it turns out that people actually, though maybe they need a little extra support in the beginning, if their symptoms are really, really, really severe, okay, but once they've implemented it, once they start feeling better, if I'm thinking about the people that I've seen clinically, I can think of one off the top of my head who still struggles to really commit to it. Everybody else has started to see improvements or has seen improvements. It is a lifelong thing for them. They feel good and they don't have any.
That's fascinating.
Yeah.
Yeah, you're right. I think that's just totally fascinating, and obviously it just speaks to the impact that it's having, as to how people, even with that impairment, can find a way to make it work and to stick to it because it's having that much of a transformational effect on their lives. So that's just amazing to hear. That it's very reassuring, I think. So I think I'm just going to look ahead a little bit to the conference, because everything you just said is so fascinating that we are so excited to explore it during the conference. So I don't know whether you could you share with us any thoughts about what you want to make sure gets discussed. On day 2, we have a panel that we're going to be focused on metabolic health, and that panel is looking at whether or not diet can fix mental health issues. And you're going to be chairing that, Erin. So I wonder what your plans are and your thoughts are for what you would like to see come out from that panel. And you can also talk about maybe some of the speakers on there that you know of, and what you're hoping that specifically they'll bring to it. That would be really great.
Yeah, I'm just excited to open up the conversation, to be honest, because there's a lot of hesitancy around diet, the word diet and nutrition, and putting that together with mental health. It seems too good to be true. And we're not here to say that diet can fix mental health issues. Like, it's not that this causes this and that fixes that. It's not as simple as that, unfortunately. However, what I do want to get across, and I think what the other panelists will want to get across, is that research, evidence, and practice is showing that, there is the people with severe mental health conditions are actually responding really favorably to a therapeutic nutritional intervention. So yes, it's deemed a diet, right? But there's a little bit more to it than that. But a therapeutic nutritional intervention, people are responding to that. And up until now, therapies haven't been so fantastic. And so just opening it up to have that discussion about where does this fit within the greater scheme of mental health treatment, like particularly within the UK, where does it fit? It needs to be part of the conversation. It's completely valid. There's a lot. We have over 100 years worth of research on the ketogenic diet. We have more research on the ketogenic diet than even any other diet, including the Mediterranean diet. So it's not like this is just a blow-in. And so nutrition needs to be part of the conversation, and the therapeutic effects of the ketogenic diet specifically need to be part of the conversation. And then, when we think about the NHS, where does this belong? Can the NHS support this? Who needs to be involved in order for the NHS to support this? What type of patients need this? Is it people in inpatient units? Is it people in primary care, secondary care? Is it community settings? Where can this work? We've got a lot of questions, and we want to open that up and have that discussion amongst all of us. And the speakers that we have this year, I'm really about, because we've got a bit of a blend. There's, we've got Dr. Ian Campbell, who, has lived experience of bipolar disorder. He's an incredible researcher, pioneering researcher up in the University of Edinburgh, doing a lot of bipolar research in the ketogenic diet and the pilot study. And then he's very passionate. And then we have Ellen, who is a fantastic dietitian, and she's focused on the food addiction side. There's things are looking pretty good for removing ultra processed foods, low carbohydrate ketogenic diet for food addiction. Who would have guessed? And then we've got Dr. Rachel Brown, who's also a fantastic psychiatrist who's using this in practice. And so bringing these people together with their background in the NHS clinically, their background of nutrition, their background in research, I think together we're going to have a really fantastic conversation about where we've come, where we are, and where we're going. Like, how could we actually make this work if it's going to help people? So yeah, I'm really, really excited. To be honest, I just want people to know that we're having the conversation and that it is a valid intervention. We need a lot more research, of course, but things are looking very good and it needs to be part of this conversation. And I'm so glad that the PHC are focusing this year on nourishing minds and changing, transforming lives and so on. So yeah, I'm really, really excited about it all. There's going to be a great panel on that second day.
Yeah, I am as well. And it's really heartening to see that everyone on the panel that you just talked about is, from the UK, doing work in the UK and has experience in the NHS. And that really is quite a great sign that we have the right people here and that people are developing in this space to give this a chance to actually go somewhere. And what do you think the steps are going to be to make that change? So if you were to be able to identify what the right area or the right level is to bring this into the NHS, what do you see as maybe some of the bigger challenges that are going to be faced in trying to make it to, a standard practice, a standard of care?
Mm-hmm. To be honest, I think that it's going to be people's opinions that's going to be the barrier, but it doesn't faze me. I don't think it phases the PHC or the people that attend the conference in general, because we've been down this road before. I remember back in the early days of the PHC, the whole focus was on real food and creating a grassroots movement to inform people, so the public and doctors and people who work in the NHS, that you can use real food to regulate your blood glucose levels, to improve your outcomes of type 2 diabetes. And though it took a long time, it took best part of the decade to kind of get it there. We're not quite there yet, but we've come a long way. And the NHS, I think, are a little bit more open to this idea that, yes, you can use nutritional interventions to regulate your blood glucose levels and so on. But so I don't think it's going to take as long as that did. I think maybe we can piggyback on that and learn from that approach, and maybe the NHS would be more open to, if they see something similar but for mental health coming through, they already can identify it as, okay, this is just the same but for something different. And so I think that the biggest challenge will be the opinions, because the bottom line is everybody wants the NHS want people to feel better, right? That the whole purpose is to treat people to make them better. That is what it is there for. And unfortunately, sometimes it just lags a little bit behind in terms of research and in terms of funding and things like this. We get it. But I think by working with like the PHC, for example, working with other other clinicians to come together as a collaborative to say to the NHS, here, listen, you don't have to come up with this. We've got the research, we've got the pilot studies, we've done them, we've got the results. Here's a program that we've put together. Here's the preliminary data from this. It's looking pretty good. You can outsource it to us, just like the NHS has done, with the other groups that the PHC run, for example. So, within the PHC, the groups that you mentioned earlier, a lot of those are used or recommended by, doctors and physicians within the NHS at no extra time and cost to the doctor themselves. And so I think this would be something very, very similar. I don't think we need to reinvent the wheel. I don't think there's any point, because this is a system that works. And all we need to do is just switch the approach a little bit and then target it at mental health. And I think the same results will come. So that's how I'm looking at it. And I'm quite optimistic about that too.
That's fantastic. And I think you're right. I think hopefully as more of these programs are starting to bed in, these will become more accepted and standard practice,
Yeah.
and the lead time to get people to overcome concerns probably will shorten, and we hopefully get a bit of a snowball effect and really see these things take off on not just on metabolic mental psychiatry, but also on all of the other metabolic diseases that we know we need to treat this way. So that's really positive that you said that as well, and it does fill me with hope that we will be moving in the right direction quite quickly and making some real improvements for people. So just moving away from the panel that you're going to be on and that segment of the conference, and looking at the rest of the schedule. Day one, we have quite a focus on type 2 diabetes. We've got obviously Ken Berry, David Unwin talking on that panel, and we're also then moving on to a debate about whether or not cholesterol causes heart disease, which is going to be one that has been talked about many times, and will be this time will include Dave Feldman and his recent research results from the lean mass hyperresponder project as well. So that's quite exciting. And then on day two, we also have another discussion about red meat and whether it shortens lifespan, so kind of a longevity angle on that, which is going to include Dr. Anthony Chafee and Dr. Ben Bickman, who was with us last year and was a fantastic speaker. And yeah, we'll also be talking about our schools program. So given that lineup, and we're so excited about it, what's kind of sticking out for you? What are you particularly looking forward to hearing?
Apart from the metabolic psychiatry thing, because obviously I'm obsessed.
Obviously.
I always have been, and I think I always will be. I've just got that bug. You know what? I'm really excited to hear Dave Feldman speak, because I followed him for, I don't know, the best part of a decade now, followed all of his work, and you know, he's really been a pioneer. He has been the pioneer, I think, in this area of research, you know, crowdfunding to get his research off the ground, and just the information that he puts out in, you know, for researchers, for clinicians, for lay people. He's really come on leaps and bounds. And also the study that he's just crowdfunding now, and then the lean mass hyperresponder information. I mean, honestly, I'll be geeking out a little bit on everything that he has to say. But one thing that I love about him, and that I also love about who was the other one you mentioned? The one on the red meat panel, Ben Bickman. The two of them, you know, they make understanding the research, they make it really accessible. You know, I'm not a biochemist, my background is psychology. You know, I'm quite far away from having a biochemical background, even though I dig in the weeds for my research a little bit. But it's tough to understand on the deep level, and they make it really easy to understand. And so for anybody that's coming to the PHC, whether you're a novice, you're a lay person, you're just interested in improving your health, all the way up to you're a researcher but maybe you have a different background, I think it's really relevant, and I think you'll definitely take something away from seeing both of those panels, because they're just incredible speakers and they have a lot to share, and they just make it so accessible and easy to understand, and just to kind of dispel some of the myths that we see on the front of magazines and papers daily. You know, we can hear it from the research source.
Absolutely, yeah. I mean, there's a real talent in not just knowing your subject, but being able to put it across to a very different audience in a way which is understandable to them. And, you know, last year at the 2023 conference, my daughter, who's 14 at the time, was sitting there listening to Ben Bickman with her jaw on the floor. She understood the whole thing. And I think if you can cut through to that level, you are really capturing a lot of people out there and inspiring them to think along these lines. So we are so pleased that Ben is going to be returning. You're absolutely right on that. And anyone else that you are particularly interested in meeting for the first time, or not for the first time?
You know, it's so exciting just to be there every year. I love seeing the same, because a lot of people are the same, and then there's tons of people that are different. And this year has kind of gone international, so you know, there are international speakers and hopefully people from further afield. But it's also just so great to get together again with people that, you know, I've known for a long time, and that I can like listen to what they've been up to for the past year, listen to their new research, their new thoughts, and just get together and talk with other people who are like-minded, as well as with members of the public, and as well as, you know, doctors and nurses and people from all different backgrounds, just to talk about, you know, what are the concerns, what are the challenges, how can we stay hopeful, how can we move these areas forward. That's what I'm most excited about, rather than one specific person. You know, I'm excited about learning from both Dave Feldman and Ben Bickman, as I said, because, you know, they break it down for everyone. But I think the lineup is so great. Like, I mean, we have Gary Taubes coming, there's Ken Berry, like pretty much like it's a crowd pleasing lineup. So I'm not going to pick one out. It's going to be a jam-packed, brilliant 2 days.
And you have been along to quite a few of our conferences in the past. So is there anything you can say to help people get a sense for what it feels like to come along, as opposed to just watching on YouTube later, because that is an option for people. But what do you think is different about being there in person?
Do you know what? I've never actually been to anything that's similar to the PHC, and I'm biased because I have been to, I think, all of them bar one or two. So way back in 2016, you know, I came along, and I was just a baby researcher at the time, and just trying to figure out my way. And obviously I was a bit nervous, and I was a bit like, oh, what am I doing here? What's this conference? Is it going to be one of those conferences where nobody talks to you and it's like all proper like snooty and conferencey, or am I going to actually learn something? And within the first 15 minutes of me standing there, a little bit like a lemon with a cup of coffee, after about 15 minutes, I had already met like some incredible people that are like, I think one lady was a fasting expert, and then another person, she liked doing park runs, and she had come along to learn. And so like within 15 minutes, I'd already kind of made connections and started chatting with people. You know, instantly I had somebody to hang out with at lunch, you know, and then it was great to listen to the speakers then in that first year, and just honestly the sheer sense of community. And that was back when the community was just being built, you know, that was the beginning. And now here we are, you know, 8 years later, and it's bigger, it's better, it's not too big. We're not talking 1,000 people where you can't find anyone. This is like getting together, meeting like-minded people who just want to share what worked for them and share it with you, so that maybe you might be able to improve your health or take the message home to the people that you love. And really, there's just something so lovely about the whole environment. You know, everyone's so open and so warm, and everyone will stop and chat with you, and you can ask the speakers all the questions that you want. And it's just a really nice, relaxed environment. And you come away inspired. You know, you come away feeling really, really hopeful about the challenges that lie ahead. And I think for anybody who maybe works in the health industry, you know, we need a little bit of that. But then also, if you're somebody who's just trying to improve your health at home alone, and you've got a whole house full of kids and grandkids, and you just don't know where to begin, it's a really good place to start, you know, because you'll find like-minded people and you'll become inspired. So that's what I would say. You know, I've been there pretty much most of the time, and I've seen it grow, and it's a fantastic thing to attend in person. The YouTube videos are brilliant at the end, but like all YouTube videos serve a purpose, right? You can't beat being there in person and meeting those people and sharing stories with one another.
Yeah, absolutely. And we get that feedback so consistently every single year. And I've been to fewer of them than you. I've only been to two, but I would absolutely agree, like that the vibe that you get of people just being positive and hopeful, and generally very healthy, and you know, the best version of themselves that they can be. And it's almost like a representation, a little microcosm of what the world could be like if we could all fix our metabolic health. And it is very inspiring to be there in person. So hopefully, if people are trying to choose whether or not to come along, please do. It really helps us as well as a charity for people to come along and to attend. And so my final question for you, and I think you've kind of touched on it all the way through, but what do you think the role of a charity like Public Health Collaboration, because we are quite different, as I mentioned in the beginning, as to, you know, what we are trying to do versus other health organisations and other health conferences. What do you think the role of public health collaboration should be in the journey that we're all trying to go on at the moment? How do you kind of see it fitting?
I think it's kind of how it always has been, and it's kind of what Sam has kind of shouted from the rooftop since the beginning, is, you know, this grassroots movement, building a community and being the change that you wish to see. And so, you know, people coming together as a community, sharing what's worked for them, but also with the science backing, and then PhD going forward, and then supporting other, you know, avenues within the community like the NHS and such, supporting them in any way we can. It's not something, the NHS can't do this on their own. It's struggling, you know, other aspects of the healthcare system are struggling. And so we have a fantastic, growing, almost international now group of people, a grassroots movement of people who are really excited and believe in this and are feeling the benefits of it, and they're willing to help and pay it forward. And so they're willing to be that change as well. So I can see that the PHC is always going to kind of walk alongside and support, you know, the National Health Service and other organizations in the country in order to help people to feel better in any way that they can. And I don't think that that's changed, you know, in the past 8-9 years. It hasn't changed, and I can only see that that's growing and getting stronger and stronger. And I'm excited about that. I really, really am, because the NHS needs a hand, and there's lots of people that are willing to step forward and make the change.
Thank you, Erin. And that was very inspiring to finish off with. So, and it's lovely to hear us being regarded in that light as well. So thank you for coming along so many times, and for this this time as well, and especially exciting for you to be on the stage and going from the first time that you attended where you weren't sure if anyone would talk to you, to now being on the stage. I think that's a fantastic story and journey as well, to hear about. So just before we go, can you tell us a little bit about where people can follow you, and any particular channels that you use, and how people can find you there?
Yeah, absolutely. So you can find me, my website, which is www.ikrt.org, so Integrative Ketogenic Research and Therapies.org. You can also find me on Twitter, so Erin L. Bellamy, and on Instagram, you've got IKRT_org, and you have Erin L. Bellamy as well. So I'm on pretty much all of them, but you can directly contact me through the website, IKRT.org.
Excellent, and we will put those into the caption as well. And just from our point of view as public health collaboration, obviously everyone here is with us on Instagram, but if you could follow us on other platforms, that would be fantastic. We are phcuk.org here on Instagram, but also on Twitter, and just started TikTok as well. And we are public health collaboration on YouTube and Facebook. So do try and follow us. It really does help us grow the grassroots movement. So if you're following us on one channel, try and get to the others. If you would like to support us, that would be really appreciated. And as we said before, the main way to help us is to please come to our conference this year. We are going to be holding it on the 18th and 19th of May in London, in Fairfield Halls, and you can buy tickets at our website, which is phcuk.org/conference. And if you can't attend in person, then we will also be offering live stream tickets in the coming weeks. But if you can attend in person, then as Erin just gave us a very good reason, it's really worthwhile doing that if you can. And yes, I think that's everything for tonight. But it's been really pleasurable to chat to you, Erin, and to meet properly. And we can't wait to have you at our conference this year, and hopefully we'll be hearing lots more from you beyond that as well. So thanks for joining, and thanks everyone online who's joined us tonight, and we will be hopefully having some more of these in the coming days, so keep an eye out for any announcements with other speakers. So good night, and thanks everybody for joining. Thanks Erin, and see you soon.
Lovely. Thank you so much, Olivia. Bye everyone.
Thanks. Bye.
Bye.